Friends, today we are going to discuss about the renal artery stenosis. In the series of the lectures of the hypertension, we are going to discuss about the renal artery stenosis. The renal artery stenosis may be the unilateral or it may be bilateral or may be related to its branches. When we talk about this disease, this is basically responsible for the ischemic nephropathy. So there may be the deterioration of the kidney function. So this is responsible for the ischemic nephropathy. Basically, renal artery stenosis is an anatomical descriptor. What is the meaning of the anatomical descriptor? Anatomical descriptor means there is the detection of the stenosis in the renal artery, but it is not necessary the high blood pressure is because of this stenosis. It is not necessary that the deterioration of the kidney function is because of this stenosis. So this is the anatomical descriptor which we found on investigation, and we are supposed to find out the cause or what are the risk factors for the disease. Now, when we talk about the causes of the renal artery stenosis, more than 90% cases of the renal artery stenosis are because of the atherosclerotic diseases, and in 10% cases the fibromuscular dysplasia is responsible for the disease. So if there is a risk of the atherosclerotic diseases, like the patient who are diabetic, uncontrolled diabetes mellitus, and the patient who are hypertensive, coronary artery disease, or there may be the occlusive aortic disease, may be on risk of the renal artery stenosis. So these are basically responsible. Atherosclerosis in more than 90% of the cases are responsible for the renal artery stenosis, and these risk factors are responsible for the atherosclerosis. So actually what happens, basically the proximal 1/3 of the renal artery is mainly involved and the ostium is mainly involved when we talk about the disease. So what happens? Actually what happens, when there is the stenosis, because of the stenosis there is the ischemia to the kidney. Because of the stenosis there is a ischemia to the kidney, and because of this ischemia, what happens, there is activation of the renin angiotensin aldosterone system, and when there is activation of this system, what happens, there will be the sodium retention, and because of the sodium retention there will be the activation of the sympathetic nervous system. Because of the activation of the sympathetic nervous system, there will be the increased prostaglandin formation, and because of this increased prostaglandin formation, what happens, there will be decreased formation of the nitric oxide, and this will lead to ischemic nephropathy. Beside this, there will be the oxidative stress, and because of the ischemic or oxidative stress, what happens, there will be the interstitial fibrosis. So this will lead to ischemic nephropathy, interstitial fibrosis, and the kidney function will deteriorate. So basically, this is what happens in the renal artery stenosis. Now, how we diagnose the renal artery stenosis? To diagnose the renal artery stenosis, we are supposed to do first of all, the Doppler ultrasonography. Doppler ultrasonography is a good test, and basically this is the operator dependent. This depends on the operator, whether how the operator is capable to detect the renal artery stenosis. Beside this, we can do the MR renal angiography, and MR renal angiography is a very good test, and the renal arteriography is basically the gold standard. Beside this, we can do the captopril renography. We can do. Beside this, we can check the plasma renin activity. So these are the tests by which we can detect the renal artery stenosis. Now, treatment. How do we treat the renal artery stenosis? So we are supposed to choose between the medical therapy and the revascularization therapy. So to choose the medical therapy, we are supposed to control the blood pressure, we are supposed to control the renal function, and we are supposed to control the other related complications. So, but when we talk about the revascularization, we are supposed to do the revascularization, and how are we supposed to do the patients for revascularization? So we usually do the revascularization in the cases of the progressive renal deterioration, and we are supposed to do the revascularization for the patient who present with the recurrent flash pulmonary edema, recurrent heart failure, and resistant hypertension, accelerated hypertension. Then we are supposed to choose the revascularization. Actually, there is a study which we call the CORAL study, in which we took the 1,000 patients, and these 1,000 patients had less than 60% of the GFR, and these patients had the systolic blood pressure more than 160, and the diastolic blood pressure was more than 110, and there was more than 60% of the stenosis, and we found there was no difference between the medical therapy and the revascularization therapy. So this was the correlate study. Actually, this depends on the presentation on individual to individual cases. So this is in brief, this is the very brief about the renal artery stenosis.